Hello, family, dear viewers. You are most welcome to the online pregnancy school. I trust you are doing well and also benefiting from all the sessions that we have brought you. If you haven't done that yet, please go ahead and hit the subscribe button and also remember to turn on the notification bell. As I say, pregnancy should be an enjoyable experience. Unfortunately, for a lot of women who go through pregnancy, because of one or two reasons, they might not enjoy the pregnancies until they go into labor and even go on to deliver. And after delivery, seeing that baby should also give you joy. And that's why we bring you the online pregnancy school. So if you are joining us for the first time today, this is the online pregnancy school. My name is Dr. Linda Vamutu. Today, I'm going to have a discussion with a colleague, and we are going to look at what we call the intrapartum period. Intrapartum is a big word, but it's just a very simple thing. And therefore, my colleague will introduce himself and also tell us what intrapartum means. Then we go into the discussion. Please call somebody and copy the link and also share with friends and family. Let somebody hear about this because a lot of maternal deaths are preventable. A lot of newborn deaths are preventable, but we can only prevent them when we know what to do. So please share with somebody and invite that person to join us. Doc, you are most welcome.
Thank you very much, Doctor.
I hope you are doing well.
Yes, by the grace of God, I'm doing very well.
We always give him the glory. We thank God. Please introduce yourself briefly to us and then tell us what is the intrapartum period.
Okay, so my name is Dr. Benedict James Afari. I'm a specialist obstetrician gynecologist at East Municipal Hospital in Accra. I'm the head of department at the same facility, head of obstetric and gynecology department at the same facility.
Wonderful. So you have a very important work that you are doing to help women and their families to enjoy their pregnancies, go through labor successfully, and also have their babies healthy, whilst the mothers stay healthy. Doc, today we are going to talk about the intrapartum period. What is intrapartum period?
Okay, so it's a big word, but all that it means is the childbirth period. So usually a pregnant woman will go through the antenatal phase, then it will get to a point that labor will set in. So from the time labor will set in to the time you will deliver, that whole period is called the intrapartum period, and it's divided into 4 stages. So we have stage 1, stage 2, stage 3, and now stage 4. Very important stage. Yes.
Thank you, Doc. So we're going to go through them, and we want to link this to the stages of labor. So briefly, what are the stages of labor and how are these two linked?
So for the stage 1 is when you come in labor, we'll do the examination to be able to check where you've got into. So for the stage 1, you have cervical dilatation from 1 up to 10. And the stage 1 itself is divided into 2. We have the active phase and the latent phase. So the latent phase is the first 3 centimeters. So when the woman comes to the labor ward and we do the vaginal examination and we realize that the dilatation, cervical dilatation, that's the cervix is the mouth of the womb. We check and it is between 0 to 3. We say it is latent phase of labor. So from 4 centimeters to 10 centimeters is the active phase. So the latent phase together with the active phase forms the first stage of labor.
Okay. Doc, during this period, when a woman has arrived at the hospital, is there something that she can do to help her go through the latent and the active phases?
Yes, so usually, even before the woman comes, the woman should have a birth plan or have labor preparedness. And by so doing, they would have been told what to look out for in terms of labor. So they will know the signs of labor. Then they would have been told the items that they need to get before they come for labor. And once they come to the maternity ward, the examination will be done. Then the process will be explained to the woman what she has to look out for. So for the woman, she has to make sure that the signs and symptoms she's aware, the items that she's supposed to have, they are all there. And she also has to come, preferably come with a birth companion. So when we get to the intrapartum we'll highlight more on that. But it's quite important that every pregnant woman hopefully should show up with somebody that will be around to offer some form of emotional support and to assist them in some of the things that they are supposed to do.
That is very important. So if you are a gentleman, you are listening to us and your wife is pregnant, please take this, that when she's going to deliver, somebody has to go with her. If you are not available, let somebody accompany her. And this means that she should plan with you ahead of time. So this should be done way ahead of time, during the time that she's pregnant. She should not wait till when she's in labor before she looks for who will go with her. That is what doctor is telling us. And it is very, very, very important. When she sees that somebody has gone to the labor ward with me or to the hospital with me, it will give her some comfort. So please take note of this. Doc, please, let's go on. So we have looked at the first stage. What about the rest of the stages?
So with the second stage, that is when the woman is 10 centimeters, or what we will say fully dilated, that the cervix or the mouth of the womb is fully dilated. So from the time the mouth of the womb or the cervix is fully dilated, so the baby comes out, that is the second stage of labor. Then after baby is out, from the time baby is out to when the placenta comes out, that is third stage of labor. Then the fourth stage of labor is when the placenta has come out, about 4 to 6 hours after the placenta has come out. That is the fourth stage of labor. So these are briefly the stages of labor.
Very good. Thank you very much. So within these periods, are there things that the woman can do to help her to go through successfully?
Good. So the first stage of labor, like I explained, that is where a lot of issue happen, because sometimes the woman doesn't even understand what is going on. And we, the health providers, too, we have a duty to communicate effectively with the woman. We should let her know that you are going to be examined from time to time. You are going to be feeling pain, and this pain is going to be incremental. And we also need to let them know that there are ways that she can also do to be able to lessen the pain. For example, in terms of positioning, in terms of medications, and in terms of she cooperating with whatever services that we are rendering. So it is this time that the patients need to listen to what the health providers are saying and to cooperate and to listen to those instructions so that it will help. Because there are times that the clients, because they are in pain, whatever instructions you give them, they don't want to cooperate. And if you don't take care, that is when adverse events starts coming in. And by the time she's ready to push, almost everybody is tired, and now the care is not optimum. Then we may not achieve what we want to achieve at the end of the day.
Doc, but you see, it is quite painful.
Yes.
It's quite painful.
Definitely.
So what can she do? If it's painful, what can she do to lessen the pain?
Yes. So when with the pain, she needs to communicate with us. Then, because with the pain, most of the time, the health provider, we have a very big stake in it, because We tend to always say that labor is painful and we leave it to chance. But no, we should help the woman to go through the labor successfully. And there are various the pain. There are drugs there. There are activities we can teach them and have the bed companion. The bed companion too can also help to offer emotional care, emotional support. And these things have been found to really help. So both the bed companion and the midwife, the doctor, it becomes smooth.
Okay. Hmm. Thank you very much. So, ladies and gentlemen, we are talking about the intrapartum care. And doctor has explained to us the time that the woman goes into labor till after she has delivered. And we are trying to learn some of the things that this woman in labor can do. But we are told that there are also things that the hospital can do, especially with the pain. And sometimes people feel like pushing when it is not yet time to push. And that can also be a challenge because it will delay the process of labor. If you have just joined us, please subscribe if you haven't done that yet. And also share with friends and family. Today I'm talking to Dr. Afari, an OMG specialist. And my name is Dr. Linda Vanutu. Doc, as we move on, can there be some challenges within this period that will not be good for this woman and the baby or babies?
Yes, so labor, as it said, is very unpredictable. But as professionals, there are some tools that we can use to be able to first predict the challenges and even to deal with it so that it doesn't get out of hand. So during the first stage of labor, once they get into the active phase, we have a tool we use to monitor the labor process. That tool is called the pathograph. And even now, WHO has brought a new one called the labor guide, and it details every little thing that we have to do for the client. And this is meant to be able to pick all the problems and the challenges that can arise in the course of the labor. Then we can put in interventions to be able to prevent adverse outcome. So when it comes to the challenges, as health professionals, we need to be very vigilant. We need to be up to date, and there should be a comments that every labor there should be as much as possible a skilled attendant at birth. If you look at the end preventable maternal death strategy that has been brought by WHO, a skilled attendant at birth is very crucial. If not, there are a lot of challenges that will arise that we cannot pick, and it will end in adverse finding. And especially, just as you said, the patient will be in pain, and because the pain is so excruciating, they will be pushing when they are not supposed to push. But if you have a health person who understands the reason why the patient is having that urge, they will now put in measures to be able to prevent the premature pushing that can end in even a cervical tear, for example, so that the labor process will be smooth. So the labor can delay in terms of the duration, can delay in terms of the position of the. Sometimes you may have a woman in labor that the position is not the right position in terms of the presentation, in terms of the lie, and these things are all issues that can give challenges. It can prolong the labor, it can give more pain. So the health professional should make sure that the examination is on point. Then all the changes, and you see now we advocate that labor is a physiological process. What it means that everybody is different and it's individualized care. Somebody will come in and within 4 hours they have delivered. Somebody will come in within 6 hours they have delivered. Somebody will come in 10, 12 hours they are delivered. So if you don't take care, you think that, oh, this labor has prolonged, and you may want to bring some understand that the labor process is physiological. We have the tools to monitor, and we can pick all the problems every point of the way. Then we don't need to panic. We don't need to bring unnecessary interventions, and we can help the mother to deliver safely.
That is very important. So we cannot do one size fits all. It's an individualized thing. You have to see this woman in labor, do proper assessment. So if you're a health worker listening to us, we encourage the mothers to come to us. But when they come, we also have a role to play to ensure that they have been properly managed, monitored very well, and every documentation is done appropriately, so that if you are not there and somebody else comes to take over, the person will read what you have written and be sure that you have written the right thing, just so that this woman can be monitored very well. Then she can receive appropriate care. Doc, thank you so much. Now, within that period, is it okay for the woman to walk around, or she has to be in bed?
Yes, so now, because we know that labor is a physiological process, they don't need to lie down throughout the period. In the past, if you come in labor, you are just confined to a bed and you'll be lying down so you are ready to push. No, you can move around. Even when it comes to even the birth process itself, you can even adopt culturally acceptable position that you'll be comfortable with. And the health providers should know that these things are allowed. They are recommended, that the woman can move around. You can even eat. If there are no risk factors and it's not a high risk labor case, you can be taking in fluids. You can be taking food. So you can be enjoying the whole labor process. You are there. You are walking around. You are sipping on something. I mean, your bed companion is there. Sometimes trying to massage your back, holding hands. So these things can all be done to be able to give the woman that positive childbirth experience. So it is allowed. Once there is no risk to it, the woman can move around, the woman can eat, and the woman can adopt any position that they are comfortable with.
That is very important, because we want them to experience this positive thing with labor and delivery. So, ladies and gentlemen, please do not fear to go to the hospital if you are in labor. Don't wait till you see that the baby's head is coming before you rush to the hospital. No. Doctor is telling us that these days you can even decide to squat to deliver, or you sit to deliver, or you lie down to deliver, whichever position is okay for you. And there are birth chairs and others that have been designed to support women to do this. So please make use of the hospital when you are pregnant. Attend the antenatal clinic, attend the pregnancy schools, and also when it is time to deliver, go to the hospital. You see how doctor is talking about this passionately. He's there waiting for you. And likewise, in other hospitals, we have other midwives and doctors who are waiting for you. So please go to the hospital. And when you are going, carry something so that when you are hungry, you can eat. If you are not told to stay away from food, he's telling us that you can eat. You can drink some water, you can drink some fruit juice that you have prepared yourself, or whatever you have in your bag. You can do that. So please pack your bag well. When you go for the antenatal, they tell you some of these things. So please adhere to that and then pack your bag well. Doc, there's also something, they said there's a way that you can breathe. You can breathe when you feel the pain and you feel like pushing when it is not yet time. How is that one? Does it work? Is it okay for the women to do that?
Yeah, so you can be doing deep breathing exercises. So when the pain is at its peak, you can take in deep breath. I mean, usually we even ask them that you can breathe through your mouth. You can breathe through your mouth. The time that the pain is at its highest peak, you can breathe through your mouth. Then when the pain goes down, then you rest. So in between, you can be breathing through your mouth than people, and it helps them with the pain, for example.
Okay. Thank you very much, Doc. Is there anything else that we should know about? Like, we know that the WHO has brought out some guidelines, and then you also have what you call the intrapartum care models. Can you share briefly about these? Yeah.
So with the recommendation, it's every stage of labor has its own recommendation. There are some of the recommendations that we already know, but there are some that have been introduced. I think if you look at the recommendation carefully, during the first stage of labor, we recommend that the pantograph or the labor guide is used throughout. Then we also emphasize the fact that the labor is individualized. Everybody's duration of labor is different, although we have allowable periods or duration that we guide. Then, of course, the fact that you can be moving around, you can be eating, that's that one I have talked about. Then, even the pain relief strategies. I mean, there are medications that we can give to help relieve the pain. We should not shy away those pain medication, because most of the problems and the challenges that occur in labor is all because of the pain, excruciating pain. So as healthcare providers, we should not shy away from providing pain relief strategies to the woman, because once the labor is pain free, it is even going to be quite smooth for you, the health personnel. If the labor is so painful and so uncomfortable, you're also not going to rest. The woman is not going to cooperate. You tell the woman to sit down, she will not sit down. You tell her to lie down, she will not lie down because she's in pain.
Yes.
And there are pain medications there that we can use. We should not say that, oh, as a woman, you have to go through pain. No, the pain relief strategies are there. We should give it to the woman. We should offer it to them. You know, pain, for example, people have different thresholds, you
Yes.
understand? But those who cannot bear, we should offer them. We should not withhold from them. So those are some of the recommendations. So right from the first stage, the second stage, third stage, then of course the third stage, for example, we know that you have to do what we call the active management of first stage, third stage, to prevent PPH or the postpartum hemorrhage. So you are
Yeah.
giving oxytocin, you are massaging the uterus, and you are doing your control cord traction. These are very important. Then the
Yeah.
fourth stage, you are checking the vitals of the woman, because we have found that women have died because they were left after the delivery, they were
Hmm.
left in a pool of blood, and they
Oh
just
dear.
died. So
Yeah.
it's not about the woman just the baby just coming out, but after that we need to care. For the model, it talks about respective care. Then we giving the woman the privacy that she needs, the
Exactly.
confidentiality. We respecting their views and their rights, communicating to them, effective communication, allowing them to come with their companions. Then, as healthcare providers, we should also make sure that we are sticking to the protocols. We are
Yeah.
doing our monitoring, our assessment, we are doing the patograph. Then, of course, when it's time for them to deliver, we are allowing them to adapt positions that they are comfortable with. We are allowing them to move around. We are giving them the opportunity for them to get the pain relief I just talked about. Then one key thing is that we have to prepare for an emergency, that if wherever you are, you cannot handle certain obstetric emergency, you should be ready to refer the
Yeah.
patient. So the referral system is part of the model, because we realize that a lot of women come with adverse outcomes because there's so much delay at the first point of call. There is nothing wrong if it gets to a point that no, this woman has to go to the next level. There's nothing wrong with that. You have done your bit. Let them go to the next level that they can get the care they want. So that is why we have what we call the continuum of care
Yeah.
from the beginning to the end. There shouldn't be a break. For us to give the woman the positive childbirth experience, there should be continuity. And you should be able to, as a health personnel, recognize certain emergencies and refer the patient appropriately. Then we should be training ourselves so that all the new strategies, the new interventions that are around that works as healthcare provided, we should know. These days, the clients are very knowledgeable, and sometimes we have this attitude of becoming angry when the client suggests certain things to. But if you are confident, if you are knowledgeable and you know some of this, you can accommodate them, because at the end of the day, you want the client to have a positive childbirth experience.
Wow. Doc, that is really important. That is all we are looking for. We want them to have a positive childbirth experience. In fact, from pregnancy, that experience should be positive through till after you have delivered and even beyond. And that is why we are talking about all these things, which means that the healthcare providers have a big role to play. Please, once these women entrust their lives into our hands, let us remember that they trust that we can do something for them. Give them that positive experience. Let them go through pregnancy, delivery, and childbirth and everything with that positive experience. You would have contributed to saving the life of a mother and also saving the life of a child, or maybe more than one of them. So please, 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 healthcare providers, doctor is telling us we have to educate ourselves, because now there are so many things that are available. Women can read, men can read, everybody can read about what happens during pregnancy. Sometimes I get some questions and they marvel me because they might have read them somewhere and they want you to help them to understand. So when they come to the hospital, this is a good time for you to educate this mother and the family. So please help these women. Ladies and gentlemen, if you joined us today, we were talking about intrapartum care and looking at how we as healthcare providers can help the women to have a positive experience when they come into labor. The other thing is that there are some things that they can do to help them, like the position, how to lie down, they need to walk around, they need to have some food, they need to take in some water, because if you are screaming and shouting, you will be tired. At the time when you have to push, then you don't have the energy to do that. That's why now things are changing. So please, when you are in the hospital, don't feel shy to ask questions. Talk to the midwives or talk to the doctor, anybody who is around. Ask any questions that you have, and that person will answer you so that we have a positive experience with the labor. If you haven't done that yet, please go ahead and hit the subscribe button and also share with friends and family. Remember to turn on the notification bell. And I encourage people to go back and listen to the previous sessions which we had all lined up for from before pregnancy up to the time of delivery and even beyond, and what you have to look for when the child is born. Doc, is there anything you want them to know as we sign off? Any parting?
So what I want to say is that we need to help the women to be able to achieve this childbirth experience. In the past, sometimes the women don't come to the hospital to deliver because of our attitude and the environment. But and now if you look at the delays in maternal mortality, it's now shifted to the facility. So there are delays in the facility. Then the quality of care that the women need, we are not given it. So as healthcare providers, we need to upgrade our skills. We need to be knowledgeable. We need to be current so that we can help these mothers to achieve positive childbirth experience. They will come to us. So once they come to us, we should receive them in good faith. We should respect them, their views and all that. Then be able to help them. And I also want to say that the family should they should support. The husbands should come around. The relatives should be around, because it is not easy for a woman to go through this childbirth experience. It's like a whole journey. So she needs the psychological support and emotional support that is important. And it has even been found out that women that show up with their birth companions, the care that they get is different from somebody who you just show up without anybody. So it is important that they have to come prepared. I mean, there are times the woman will come, she's not having anything for the baby. It's not the best. Let's prepare. You've decided that you want to bring a life to the world. Let's prepare. And it shouldn't come as an emergency to you. Let's prepare and make sure we are ready, so that at any time the baby has to come, we are all ready to welcome the baby to the world.
Thank you so much, Doc. We are all ready to welcome the baby into the world. Please come prepared. We have 9 months to prepare for a delivery. In a few instances, you might have your baby before the end of the 9 months, but most cases, you have the baby after 9 months. So please be prepared. We have spoken about how to do this, the finances to help you to prepare, and how you can go about that. You can put a little money down every week, every month. As often as you get the money, put something small down and then start buying the things one after the other. When you have money which is enough to buy that beautiful dress they call baby welcome, buy one. When you have more, buy two. Gradually, you find that you fill that bag, which you can take to the hospital. So be prepared. And for the health staff, please, I think that it is time for us as individuals to look at what we do for the clients who come to us. Assess yourself and look at how many people pass through your hands. How many pregnant women have come to you in the month, in the year? How many of them would you say were satisfied with the services that you provided? How many of you would look at how many of these women went home with the babies alive and they themselves were alive and healthy? It's time to do that so that together we can prevent these maternal deaths that are preventable, as well as the newborn deaths that are preventable. It is on us as care providers working together with the families to ensure that pregnancy becomes a time of joy and not anxiety or fear. Please share any comments you have with us. And if you have any question that you would like us to answer, don't hesitate at all. Share them with me and I'll get a colleague, either Dr. Fari or another person based on the question to discuss those questions with you. On that note, Doc, we want to say a big thank you to you. I know you are very busy, but for the passion and the fact that women have to have this positive experience, you have found time to join me to do this discussion. God bless you. And to our viewers, we say bye for now. So we see you again in our next video. Take care. God bless. Bye.